Taking proper care of your teeth is important to your overall health and well-being, and the Cumberland County Public Health Department is working to promote good dental habits in children. Each year, the dental clinic visits all Cumberland County public elementary schools to screen kindergartners as well as 2nd and 5th graders. Dental Director Dr. Russell Holderness tells us about the clinic, which serves patients ages 6 months to age 20 by appointment.
Proper dental health is so important because the teeth affect the whole body, and researchers are realizing that more and more. So that when you, if you have an abscess or an infection in your teeth, that gets in your bloodstream and travels throughout the whole body, and it makes you sick. So it's not a separate entity to be neglected. It's something that really affects your overall health. The keys to prevention are good hygiene, a real good routine, getting a nice schedule of brushing for 2 minutes twice a day, flossing once or twice a day, also getting regular checkups so that if there is a problem, the dentist can find it, the hygienist can find it, and then if you need a filling, get the small filling at that point. People today do not necessarily link up the importance of diet with dental health. It's one thing to and it's a very important thing to brush the teeth and have good oral hygiene. But if you're going to eat a lot of sugar, particularly sodas with sugar and acid, then you can have meticulous hygiene, but you're really digging a hole for yourself as far as getting cavities. So really need to respect the diet component of the oral health in addition to the good hygiene. So that and flossing is a big part of that. A lot of people brush pretty regularly, but they skip the flossing now and then. But really, flossing is the only way to clean in between the teeth. So if you're not flossing, you're not getting that area clean. Another pet peeve is when people actually will have a tooth that needs a root canal, get the root canal and then stop right there. Most of the time when you get a root canal, especially on posterior teeth or the back teeth, you need to get a crown to keep the integrity of that tooth intact, because when you do the root canal, you remove a lot of tooth structure and that tooth is weakened to the point that yes, you're out of pain and it's not bothering you anymore, but you haven't finished the job yet. At the Cumberland County Health Department, we see kids from when the first tooth erupts, and usually around 6 months, to 20 years of age, Monday through Thursday. And our clinic hours are 7:30 to 5:30, Monday through Thursday. And we do pretty much all-encompassing dentistry on the kids. So if they need anything from sealants, we do a lot of prevention and sealants. We do oral hygiene instructions, we do cleanings, we do restorations, we do extractions, and a lot of fillings. And also we try to keep the space if we have to pull a tooth, so we do space maintenance. If we can't do it here, we refer them out to somebody that can do it, like for oral surgery, complex oral surgery, or endodontics kind of things, or braces. We take walk-ins. We triage walk-ins for adult emergencies, which we also see on Monday mornings only. So that's a half day on Monday throughout the week. We will triage you, but and then if need be, put you on antibiotics and at least see you so that we don't turn anybody away. And if we can fit you in the schedule, granted you are a walk-in, we would go ahead and if we can get that tooth out, if that's the case, or refer you, we'll take care of that at that time. But we don't want to turn anybody away, so if you don't have an appointment, of course you can come in for emergencies only. Otherwise, we ask that you make an appointment, and that way, like I said, we can plan and schedule for your visit appropriately. We require on the first visit proof of income, and that allows us to apply our sliding fee appropriately. So the fee is of course based on your income. So if you're in a certain segment of the population, you don't have to pay full price, and we verify that, and then you can slide the fee and adjust the fee accordingly to your income all the way down to $10. If a patient is afraid of coming to the dentist, please come, because we can work with that, and it's basically we can step the process and get you acclimated without coming in and trying to do everything at once. We can take baby steps and help you to get over that fear through talking about it and show. We have a process called Tell, Show, Do, where we tell you what we're gonna do before we do it. We show you, and then we do it. So a lot of the anxiety, I think, is based upon not knowing or being uncertain about what's going to occur. So we try to alleviate that. And we don't try to do everything in one visit. So if you're getting anxious and you want to stop, that's okay. We stop and we can bring you back and pick up where we left off to try to overcome that dental fear. In conclusion, we would love to treat you here, and we'll work with you on pay. We also have a lot of a team of translators that if English is your second language, then we can work with that. We have trained interpreters, and so really please get regular care at 6-month intervals at least, and come on in if you're having a problem that we find. We'll generate a treatment plan and then treat you, and that coupled with good hygiene and good oral care regimen of brushing twice a day, flossing once or twice a day, and really controlling the amount of sugar that you intake. All those three together are great components to help ensure that you have a healthy oral cavity.